This podcast is brought to you by Raising Mama, a bamboo baby brand dedicated to empowering moms during postpartum and raising awareness about maternal mental health. Raising Mama's buttery soft bamboo pajamas aren't just designed to help babies sleep better, they're made to support mothers too. And for every pair sold, a portion of the proceeds is donated to Postpartum Support International. As a thank you for listening, enjoy 20% off your next order with code RaisingMamaVillage at checkout, because we're all in this together. Coming up.
So I always tell people, if you have gestational diabetes, that means your placenta is working really well. So there's the plus side of that. Those hormones help your placenta function, and the placenta nourishes the baby. As far as how it keeps our blood sugars up, and kind of like an easy way, I think, to understand it is those hormones make us more insulin resistant.
Hey, y'all.
Hey, mamas.
Welcome back to Raising Mama.
I'm Megan.
And I'm Chelsea.
I'm a divorced mama of 2 toddlers, sharing custody while running my own business.
And I'm a full-time nurse, pregnant with my second baby, and married to a stay-at-home dad.
Join us while we talk about the most pressing issues related to postpartum and new parenthood. Before we dive in, hit the subscribe button for more expert insights and honest conversations on Raising Mama podcast. Today, join us as we break down the facts about gestational diabetes with registered dietitian Leslie Flannery. With over 13 years of experience working with pregnant women, including roles as a breastfeeding coordinator at WIC and a specialist in maternal fetal medicine, Leslie saw firsthand how little support women received after a diagnosis. Frustrated by the one-and-done approach of a single office visit, she launched her virtual practice to provide ongoing personalized care. Leslie is here to set the record straight. Gestational diabetes is not your fault, and you can manage it without cutting all carbs. Thank goodness. This episode covers everything from understanding why it happens to practical tips for eating well, staying full, and navigating cravings. Welcome, Leslie.
Hi. Thanks for having me.
We've had a really good chat so far, which is why we're all like slightly giggly right now, but singing Little John songs.
With the Band-Aid here. So gestational diabetes, I know it's pretty common. You might have a better statistic on just how common it is. Do you know what the running statistic is?
Yeah, I was actually curious. So I looked it up before we hopped on, and worldwide, it's about 14% of all pregnancies have gestational diabetes. And then in the United States, about 10% of all pregnancies have gestational diabetes. Yep.
And from my personal experience, I know women who have gestational, like my sister had it, and she's like a straight up beach body coach. Like she's very fit. And so I was just curious, like, why do some people get it and why do some people not get it? Do you know like why that is?
I mean, it is so nuanced. Like as individuals, we're all so different and have different genetics and different family history. And then when we become pregnant, we have the placenta that sends off hormones. And our hormone levels are all different, woman to woman too. So it's really nuanced. You can't like just pinpoint and make a real broad stroke statement, I don't think. But I will tell you that the placental hormones are like the driving factor for it, because there are some women, like you said, like your sister, who is like super fit, probably knows a lot about her nutrition, like focuses on those things and ends up with it. And then I have also met a lot of pregnant women who aren't that way. Not necessarily that's a bad thing, but they do indulge in their sugar cravings. They're not very active. They're not focused on their water, and they don't get it. So it's really hard to say like a blanket statement, but I mean, there are risk factors, and the placental hormones are the main driver of the diagnosis.
What determines placental? Because I was reading, okay, I'm lying. I wasn't reading. I was watching a reel, but like, because that's how I was reading captions on a reel.
Yeah.
So what anyway, so, but that like, there's a lot of male input in determining how healthy a pregnancy is, like what the man does like the year prior, to inseminating, I guess. And I'm probably explaining that the wrong way, but is that like is that related to placenta stuff, or is it really just like genetics or just chance, like what, your placental hormones end up as?
Yeah, that's a great question. And to be honest, I've also seen little snippets here and there, probably on social media, talking about that. I've not actually read research articles, like scientific backed evidence to say that, but I think that we'll probably have a lot more research coming out in the next, 10 to 20 years to look at that. I would think that would be super interesting to know if the male's genetics are playing a role in mom's gestational diabetes. Gosh, I'm sure a lot of women will feel really nice to know, like, oh, it's not all my fault, because there's so much pressure with it.
Well, It sounds like what you're saying is it's not a woman's fault anyway. A big determinant of this is really just that your hormones change when you're going through pregnancy. And I was wondering if you could break it down a little bit more, like what exactly are the hormones doing that are making it harder for us to, bring the sugars out of the bloodstream in a quick enough time, essentially? Like, why could we process the sugars before? And now what is the hormone doing that's making it so hard?
Yeah, the hormones are super important too. So I always tell people, like, if you have gestational diabetes, that means your placenta is working really well. So there's the plus side of that. Those hormones help your placenta function, and the placenta nourishes the baby. So that's what the hormones are doing. As far as how it keeps our blood sugars up, and kind of like an easy way, I think, to understand it is those hormones make us more insulin resistant, and insulin resistance is basically your insulin isn't working as efficiently, as quickly as it should. It's just like slowed down, a little sluggish, for lack of a better word. So blood sugars just stay in the bloodstream. Glucose stays in the bloodstream a little bit longer because insulin's slower due to those hormones.
And when you take the test, right, when you go to the doctor's office at whatever week it is, they make you drink like the sugar, and then you have to take your blood test, and it says whether or not after fasting for an hour, if you're in the correct sugar ranges. If you, fail the test, why are they so concerned that your blood sugars are high and they're not going down as fast as they can? Like, you're saying the hormones are good because they're helping the placenta, but why is it bad to have sugar hanging out in your blood?
Because it can eventually cause some adverse outcomes with baby that we don't want to see. If mom's blood sugars stay too high, then the baby starts to produce more insulin in their body, because mom's insulin that she makes in her pancreas doesn't cross the placenta, doesn't go to the baby. So her insulin's working to try to lower her blood sugar. But if mom eats something and her blood sugar is really high afterward, then that glucose goes to the baby, that sugar is going to the baby. And if that happens, then the baby can start to produce more insulin. And the worry with that is then when the baby's born, and you cut the umbilical cord, so now they don't have mom's nutrition coming in anymore, but they have a lot of insulin that their body's produced. It would be like us injecting ourselves with an insulin when we don't need it. They're going to have a low blood sugar. So that's one thing. Wow. And then another, I would say that and shoulder, and I always say this word wrong, dystocia. Shoulder dystocia, where the baby puts on more fat, specifically around their shoulders. They see a higher incident that with gestational diabetic babies. They put on fat disproportionate, like to a baby whose mom doesn't have gestational diabetes. So the worry with the shoulders being wider and a little broader is then a vaginal delivery, and baby could get stuck. So those are the two common things. Other kind of rare things that could happen is baby can have some breathing issues, trouble regulating their temperature after delivery. And then, not to scare anybody, but if blood sugars are really, really uncontrolled and unmanaged, and usually we see this when someone's diabetic prior to pregnancy coming in, then there can be the risk of stillbirth.
Wow. Okay. So you want to...
Not to get me down. I don't want people to think that.
Okay. I mean, I can see why it puts women in this high elevated anxiety state, because pregnancy is hard enough. And now you're like, oh my God, if I can't keep my blood sugars in check, I might, worst case scenario, cause a stillbirth, or maybe a larger baby that I can't give vaginally, or I might just be giving them too much insulin so that I'm giving my baby a poor head start. So they're basically like burning the fuel faster than they can when they first come out. That's it's pretty darn stressful.
And I just want to say on the flip side of that, because I don't want to scare people by like, the stillbirth thing is really, really scary. I will tell you in my 6 years, I maybe have known one person that has had that outcome over hundreds and hundreds and hundreds of women. I also like to say those are the risks, but I feel like we should be telling women in the same breath, you could absolutely have a healthy pregnancy and deliver a healthy baby with good blood sugar. So not to scare.
That's a good point. Yeah, to mention.
I feel like what happens is women are told those risks and that's all they can think of and get out of their head. Like obviously if someone tells you you could have a stillbirth, like that is so scary. Like that's the ultimate last thing you would ever want to happen. So that's so scary, but it's very rare. I wish I remembered the percentage, but like compared to a normal pregnancy that does not have gestational diabetes, the risk, it doesn't go up that much, but it is increased.
So I imagine that if you just got told you have gestational diabetes, you have your 5-minute doctor checkup, and then the last thing you heard is this could potentially lead to a stillbirth. People get into these crazy mindsets where they're like, I can never eat a carb again. I can't have any high sugars. Why do you think that mindset is actually not productive and can even like put you in the wrong direction?
Yeah, I mean, a couple of reasons, I think, and I've heard from many women clients who have, this is kind of like a side note, have had past history of eating disorder. And so imagine like if you've had that past where you're like tracking food and looking at every single thing that goes into your mouth and really worried about weight and all of this. And now you're told you have to track everything and it's like your baby's dependent on it and you need to really be nailing down. So that's one reason I'm like, oh, please don't get into a restriction mindset. We need you to be healthy. But I think the most important thing when it comes to blood sugars is that we have to keep in mind that these women are pregnant. So they are building a human. There is an extra calorie need and energy need required to do that. So if we're cutting carbs, we're also cutting calories. So now we're under eating for pregnancy, and that's not a good thing either. But really, too, it can backfire your blood sugars because if you go longer than about 3 hours without eating, your blood sugar dips low. It can dip too low. And then your body is a little bit panicked, like, oh my gosh, am I going to get carbohydrate for energy? So your liver does a really cool thing for you and it converts your stored fat and protein into glucose and it dumps it out. So now we're seeing high blood sugars. So it becomes this pattern of like up and down when you restrict carbs. So it's not good on a lot of levels.
Wow. Oh my gosh. If I was a mom listening, I'd be thinking like, gosh, damned if I do and damned if I don't. You know, on one hand, I need to make sure my sugars are perfect. And on the other hand, if I don't eat sugars, then my liver's going to just still screw me over anyway. Like, what is the answer? What are they supposed to do?
I mean, it is a fine line. So I say it all the time. Like, you can absolutely have carbohydrate in your diet. I think you should. It provides a lot of nutrients and energy that you need. But there's a way to do it, like learning how to portion the carbohydrate and then how to pair the carbohydrate with other things like protein and fat and fiber. That's the key to keeping your blood sugars balanced and also making sure that you're nourishing yourself for your pregnancy and you don't feel restricted and go down like old eating habit patterns. So like just learning how to eat them is important.
Do you recommend, because another citing social media again, like, glucose goddess or it's I think it's become increasingly more popular for people to get those little glucose monitors, even if they are like not diabetic. And I've seen this within kind of diet culture too. And, it's got like the app. It's like all of this is becoming more trendy now, but would you recommend doing something like that? Because here's the thing is like my thoughts on it are, I personally would also not want to go down the road of like obsessively tracking because I've done that, like been there, done that. And it's kind of like not a way to live, especially as a mom. But I feel like there is value in like knowing your body and like knowing where you're at, because a lot of it, sometimes we're just going on like a feeling and like, at least how I've never done the like little glucose monitor thing with the app, but like a while back I got a BAC blower and it wasn't because like I got a DUI or anything like that, but I actually had a friend pass away from a drunk driving accident. And so I decided to get one just because I wanted to, for one, have it readily available in case a friend wanted to drive or whatever, blah, 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 blah. I got it. But it was great having that data. Like, so now I feel like anytime I consume like a glass of wine or a couple glasses of wine, or I go to a brewery, get a couple beers, like I've blown so many times that I know I can guess like to the 0.01, like where I'm at. And I feel like these glucose monitors and maybe knowing where we're at, we maybe get like a better idea of like, oh, wow, it is dropping. And that is why I'm feeling tired or whatever. So I don't know. I guess I just wanted to hear your thoughts because for one, they're trending. And two, I feel like they would be really applicable to this situation. Maybe.
I'm actually so glad you asked because they are becoming a lot more common. Like since I first started doing this, when I worked in the maternal fetal medicine office, our physicians and nurse practitioner who manage patients wouldn't let patients wear them. They don't approve them. And the reason is because on your arm, they measure the interstitial fluid in your arm versus like blood capillaries that you're measuring when you poke your finger. During pregnancy, you have a lot more fluid in your body, you know, from amniotic fluid than your interstitial fluid. You have more of it. So those readings become more inaccurate because it's diluted, especially as the pregnancy progresses, because you have more fluid as you get further along. So I don't personally like them for that reason because I just feel like they're not as accurate. I think the technology is cool, like you're saying. I mean, it is cool to be able to see in real time. And for my clients, like I do work with a lot of people in healthcare that are just busy. They don't have the time to stop and check their blood sugar, or have a client now, her blood sugars are staying pretty steady. So her doctors want to see what's going on all the time. So I understand there's a time and a place for them, but I think you have to know like how to interpret the data specifically for pregnancy. So there's usually like a 20 to 30 minute lag time on it. And then, like you said, too, you know, worked with many, many women who've dealt with past eating disorder kind of habits. And that becomes very anxiety provoking to be like looking at data all the time. And they want to analyze every single thing that they're seeing. Whereas when you're checking your finger, you don't have to do that as much.
Yeah. It like encourages the thought pattern that you're like trying to stay away from.
Yes, exactly. Yeah. So I think I tell people like if it's causing too much anxiety, I think it's time to take it off. And I've had quite a few women who choose to do that. But I do think it's good to have a regular glucose meter on standby for any time you're seeing like really high or really low numbers on the CGM. Just double check it like with your finger poke.
All right. We're going to pause the show for just a minute because I want to share something personal with you. After having my first baby, I felt completely unprepared for how challenging postpartum life would be. I quickly realized that society just doesn't give moms the support we deserve. That's why I created Raising Mama, to make those early days just a little bit easier. Raising Mama pajamas are made from the softest bamboo fabric, engineered with micro gaps to help babies sleep better and give mamas a much needed boost. The prints feature uplifting messages like, "Mama, I wished for you," and "It's okay to ask for help." Phrases that are meant to prevent those negative thought cycles that so many of us struggle with during postpartum. And because you're a listener of this podcast, I want to give you a special 20% off with the code Raising Mama Village. Plus, every time you buy a pair, we donate $1 to Postpartum Support International to support maternal mental health. Thank you for being a part of this journey with us. Now let's get back to the show.
Is there ways to tell without poking your finger if you most likely have low blood sugar or high blood sugar, or is it kind of like silent?
Yeah, I mean, for some, right. Some people are going to be more sensitive to how they're feeling, and I think some people are just more in tune with their body, so they know, and others might not. Low blood sugar, usually you're going to feel dizzy, lightheaded, shaky, might get confused. High blood sugar, usually really, really tired, very thirsty, might be sweaty, might feel nauseous. So anytime I say if you have gestational diabetes, or maybe you haven't been diagnosed, but you're in pregnancy, grab a glucose meter and just check your blood sugar. Low iron symptoms, very much mimic low blood sugar symptoms. And it's common for low iron in pregnancy too. So I would always check your blood sugar first before you like treat yourself by having sugar. Because if it's like your iron, then you wouldn't want it sugar.
Do OBs like tell you all this stuff? Like when you get...
Well, I mean, it just depends. It really depends. There are some amazing OBs out there. A lot of them have seen many, many patients in a day. So to get like this level of information, typically not.
So let's say you're just like a mom, maybe you already have kids, maybe you're working, maybe you're busy. Even just like pricking your finger 5,000 times a day is a little bit anxiety inducing. Is there just sort of like a go-to snack meal that you're just like, dude, if you just stick to this, chances are you're doing a good enough intervention to help, support the health of your baby and yourself and gestational diabetes?
Yeah, I think especially for busy moms, because I'm one of them. You don't have to strive to be perfect. So it's not like you have to eat if you want organic food, that's fine. I'm not here to bash on organic food, but you don't have to go have like all the most natural organic. Like if you want to go through the drive-through because that's all you have time for, that's going to be okay too. The main things you want to aim to get are a portion of carb that ideally has high fiber in it. You want protein, you want some type of fat if you can get it, and then another source of just fiber, like a non-starchy vegetable. So Chick-fil-A Cobb salad, that's a great if you're busy running through, maybe even have like a couple fries to go with it. I pretty much think you can eat anything that you probably were eating beforehand. If it's spaghetti, if it's tacos, if it's pizza, I think it's just about keeping those carb portions to the appropriate size and making sure that you have all the other things to go with it.
What's the appropriate size?
So it depends on each carb. So like, for instance, you want to aim for 15 grams of carb. That's one serving. So it's going to be different. For bread, it's a slice of bread. For berries, it's a cup of berries. For quinoa, it's a third cup cooked. So it's different for each different type of carb. So looking at labels is really helpful when it comes to like counting your carbs for gestational diabetes.
Okay. So it sounds like don't avoid carbs at all costs. Don't go Atkins. Definitely
Correct.
Make sure you have your carbs or it's going to backfire. Definitely don't just stop eating because your liver is going to mess you up anyway.
Correct.
And when you eat what you are normally eating, but maybe be a little slightly more mindful of the carb that's on the plate.
Correct.
Like you could have an open faced sandwich instead of a 2-bread sandwich.
Yes.
Or like a little bit more of the meat on the spaghetti than the spaghetti or whatever.
Exactly.
And that should like help guide you in the general direction, which probably realistically is what we all should be doing anyway.
Yeah, I mean, this is the trap that I would be falling into, is that when you get pregnant, you generally stop drinking all alcohol. Or, some people have like a little bit of wine here and there or whatever, but that's like a whole other topic. But because of that, I'm like, what else can I have? And so I like start eating like more chocolate or like whatever, because I don't know, man, like sometimes you just need like a dopamine hit at the end of the day because you're like stressed out. So like, what if you've like accidentally developed a sugar addiction like prior to getting pregnant, or like a muffin addiction? Asking for a friend.
Well, I have the world's biggest sweet tooth, so you're asking a good person for that. I think you can have sweet treats. Palm of your hand is a really good estimator for a serving of carbs. So if it's a piece of cake, a cookie, maybe it's 2 small cookies. Dark chocolate, actually, in fact, is more of a fat. It's a really high fat content. So I wouldn't even worry about that as being a carb. So you could have some dark chocolate. But the key would be to make sure you have some protein to go with it. So if it's like your baby shower and you want a cupcake, throw some nuts there with it, protein and fat, or a couple pieces of cheese, or maybe you have some leftover meat. So just making sure that you have protein to go with it.
Any other hacks like that? Like I used to work for like the apple cider vinegar people, Bragg. And I remember I read so many studies because I was in like the health science department, but I was forced to read so many studies about pre-diabetes and how having like the vinegar water with that. Does that stuff work for this application as well? Or like,
yeah, well, it sounds like you read way more research than I Yeah, if you were with the apple cider vinegar people. I've read a few articles. And I do have clients who do it. It seemed like the research that I had read was mixed or smaller sample sizes or maybe not specific to gestational diabetes. I don't think it's going to hurt a thing. So if people want to do it and they get that benefit from it, absolutely. I mean, I would always say to dilute it in some water just so it doesn't hurt the enamel of your teeth.
Yeah.
I have clients who do it and they swear by it. They do it religiously. And then I have other clients who are like, it's not making a difference. I don't think it's going to hurt anything. I don't think it's like the magic pill. I'll say that.
What you're talking about. What are you talking about?
So, yeah, it's apple cider vinegar is supposed to have blood sugar lowering effects.
Oh, okay.
I should have added that in there. They likened it to, like drinking apple juice versus like eating an apple with like the fiber going into it and that reducing like the effect of something. I don't know. That's how they like spun it. I don't know if there's any validity to that, but
okay.
Again, cinnamon is another one. Cinnamon has been shown to have properties that help with blood sugar. So I think like, if people want to put, cinnamon on their oatmeal or put cinnamon on their Greek yogurt, totally fine. I think all the other things like the portion, the pairing, water, getting good sleep, hydrating, exercising, like all of that together as well.
Yeah. Yeah. That is the official Leslie Flannery recommendation. Got it.
Love it. All right. Well, here's my tiny story. Right now, I'm pregnant. I do not have gestational diabetes, but I do count all my calories and I do have like my exercise plan. And if you were to ask me, like people always ask me like, how's your pregnancy? Right. And I'm always like, it's good, and then my sister's like, how's your pregnancy? And then I'm like in a 2-hour cry fest. And it's all about like, I'm counting my calories and my weight and so the mental load of just like trying to balance nutrition and exercise while pregnant, it is, in my opinion, like not fun. It is so, I don't know, like it's the number one thing that people are like, I can't sleep at night, or, my ankles are swollen, or, my hormones are crazy. And I'm just like, God, another day of having to like grit through a diet is 100% what is making this pregnancy so brutal. My reasons are different. It's not gestational diabetes. It's just I gained 70 pounds my first pregnancy. And by the time I had my second kid, I had only lost 40 pounds of that 70. And I was like, dude, if I gain another 70 pounds, like this isn't helping anybody, So those were my reasons. But I really relate to the person who like pretty much is like prescribed. It feels like you're prescribed from your doctor to be like, if you're not a good dieter, like you're not a good mom, like your baby's going to suffer, like you're going to suffer. And it's just takes such an emotional and mental toll that it's like, I wonder in your opinion, I mean, how does the mental anxiety of it all like outweigh the positives of being overweight? Because that's what I think of all the time. I'm like, God, what if I just gave myself a couple months to be like, whatever, I'm going to just feel my cravings and gain some weight and call it a day. I'm not Kim Kardashian. Like my body doesn't have to be this perfect size. Like, I don't know. I'm just wondering if that's even an argument or if that's an excuse. Like, is there an argument to like, if it just brings you so much stress, like you can kind of just avoid it? Or is it like, no, you really do need to like listen to what the doctors are saying and try your hardest? Like, where is that line of this? I don't think that when a doctor tells you to diet, I don't think they quite realize just what an emotional and mental tax that is on a person in general, on a pregnant person, and particularly on so many women who already have eating disorders and body image issues anyway. And all I'm doing is doing everything I should. And all I'm doing is seeing my belly get bigger and bigger, as it should. But it's just like, I don't know. What do women have this issues when they work with you? Like, how do you work with that?
I would say yes, but right behind like the biggest issue of like people cutting out carbs, like the second hardest part of it is the mental part, for sure. Like mental exhaustion, for sure. And I am a dietitian who is like weight neutral. I take a weight neutral approach, meaning I think weight in pregnancy and when we're not pregnant is one little piece of the pie of our health. Weight doesn't tell me what your cholesterol looks like. It doesn't tell me what your blood pressure looks like. It doesn't tell me what your blood sugars look like. I would much rather those all be good and in line and you healthy and baby growing healthy and your fluid levels are good than a number on a scale. Because all of us, even when I'm not pregnant, I retain extra weight during this time of my cycle. And then I'm not over here. And then somebody else is built different than me. So like we all just hold weight differently. Same is true in pregnancy. Some people lose a little bit of weight when in the first trimester if they're sick and then they gain it or, so we're all so different. And it drives me nuts sometimes when physicians are very specific to women with their weight. And I'm like, no, our goal is that your blood sugars are well managed, you're healthy, baby's healthy. That's the main goal. With that being said, in my program, I do have my clients, it's optional. And if people have a history of eating disorder and this is like really triggering for them, they don't do this, we don't do this. But I have a food log that I have them fill out. Again, optional. Each week I look at it so I can see what they're eating and what their blood sugar numbers are. We don't count calories. I'm more focused on like their portioning of the carbs and if they're getting enough protein and fat and fiber to go with it. If at any point I can sense that they are like getting exhausted by it all, because tracking your food is like a full-time job.
Oh, it takes away the joy of eating for sure.
It does. Yeah. So what I will
have ADHD. Like I have ADHD and like
yeah.
The like I get stressed about being stressed about needing to plan
yeah. So what I'll say is take the day off, take the weekend off, just enjoy yourself. Like after a week or two of doing that, you kind of get to know like generally how you're supposed to eat and what portion. Take time off of tracking. Some providers will even, for women who are testing their blood sugars, let them take time off of testing their blood sugar because they're tracking all their meals and they're testing 4 times a day. It's a lot.
Mm-hmm.
My opinion is your mental health is just as important as your physical health. And if you're not doing well mentally with all the tracking and looking at food, then we need to take a break for a minute and reset. And every time women do that, they hop back and they're like, I feel so much better about this. So I think just taking a break if you're feeling exhausted and you're not finding joy, you're waking up like, I have to count calories again. I have to look at my food again. Time for a break.
Isn't it crazy how like we have to like women in general have to be told by someone else to like take a break? Like I just feel like the advice you're giving is, yeah, if you're really exhausted and going crazy, take a break. And it's like, oh, really? Like, that's what I do. But it's like not intuitive sometimes. And it rings true with like so many topics.
It's also like white coat syndrome. Like if somebody says like your unborn child will have severe consequences if you don't do this. Like, do you know what I'm saying? It's not like you're just bringing it on yourself. Like you have full responsibility for creating life and bringing it in the world. Like it's a pretty daunting thing.
Yes.
So you're kind of wondering like, to what extent am I supposed to be suffering to help the baby? To what extent does my suffering actually hurt the baby? Like it does get murky. And
that's parenthood though, but
because you having high cortisol levels isn't good for you or anybody else either. Yeah, that's why I so wish when they said, like, you have gestational diabetes, here are the things that could go wrong, but here, everything can go right, too. We deliver women all the time that have healthy pregnancies. Like, that has to be part of the conversation.
Yeah.
Yeah. I wish, like, healthcare providers were like, oh, you have gestational diabetes? Cool. Here's your, like, gestational diabetes counselor. Like, here's some therapy to go with it. Because I bet there's a lot of mental load that like it is almost to me, of course I'm going through it, but it just seems like the two are going together. And so just giving you the science behind it is not the whole picture. Like actually seeing the whole woman going through the process is what's I think lacking a lot of the times in the medical field. Like you're not just this person that eats a carb, like you're living the whole life.
Yes.
Oh,
exactly.
boy.
Well, why don't you like because you have a lot of great resources and tools, and you do consulting too, right?
Yeah. Yep.
So how can listeners like where can they find you? And like, what are you offering right now that you think could be useful if someone, did get diagnosed with it?
Yeah, I think everyone's at a different point, too. So I have a lot of little different things, different resources. I'm on can't talk. I'm on the gram, on Instagram at Gestational Diabetes Nutrition. I'm there all the time. If you want to even shoot me a DM, I reply to all my DMs. So you can send me a question. But if you are newly diagnosed, I know I'm in there all the time. If you're newly diagnosed and you're like, I don't know what I should be eating and how to be eating, they just gave me a list of like what to avoid, because that's typically what happens. Or here's food you can eat, but in not real life scenarios. I have a meal plan. Great place to start. Has everything portion and paired, 30 days, meals, snacks. So that's all planned out for you. I also have a journal, which I love, because like you're saying, the mental exhaustion of all of this is so real and a huge part of this diagnosis. It has coloring pages to help with like stress reduction. It has a grocery list. So like where to get started as far as like, okay, if I go to the store today and I get these things, I can work with this. It has a tracker so you can write down and keep track of trends. It also has like a mini like birth plan, things you should ask your provider now that you have this diagnosis. And then I offer coaching, personalized coaching, one-on-one. So when I was in the maternal fetal medicine office space, it's like what you're saying. I saw people one time, like one and done, and who knows if they had questions afterward. So this way I have developed a program where they can reach out to me at any time. They can send me texts. I can answer their questions, explain things to them, and just not only help with their blood sugars, but be that support system that is also lacking for the mental piece of all of this.
Oh, I love it.
Yeah, well, that's great.
We could take your brain for sure.
Yeah. Thank goodness people like you exist. I mean, I think that is all so thoughtfully put together to fill this gap. And I think you're doing the Lord's work. And I bet you've helped so many women with this.
It's so rewarding to just get a message from a client saying like, you saved my mental health. It's more than just the food part of it. To be a lifeline or a lifesaver to someone to get through their pregnancy is like, it means the world to be able to help people that way.
Totally. Well, thank you so much for coming and chatting with us. We'll drop links to everything in the description, including your website, gdmnutrition.com, and your Instagram at gestational.diabetes.nutrition. And yeah, if anybody has any questions for Leslie, don't forget to DM her, or you guys can comment on this episode and we'll send it over to her. And it was so lovely having you. Is there any like last final thoughts? Anything like you want, just women to know?
Yeah. Well, thanks for having me. Really fun. I would say my biggest tip would be to have grace with yourself, because this is a brand new thing that you are having to learn. You might be having to relearn how to eat, what carbs are, what protein is. It's a lot, and it's pretty much all on your shoulders, it can feel like. So just have grace with yourself. It's a learning process.
I love it. Couldn't say it better than that. All right.
Thanks, Leslie.
Bye.
Bye. Thank you.
Thanks for joining us today. If you enjoyed this episode, be sure to hit subscribe so you don't miss out on future conversations. And follow us on Instagram at Raising Mama Podcast for more updates, resources, and a peek behind the scenes. See you next time.